Hi, this is Dr. Grande. I hope you find this video useful. If that's the case, please like it and subscribe to my channel. And as always, thanks for watching. So let's talk about this. So those type of thoughts, like I can't make a mistake or something like that, we call those automatic thoughts. And we'll have plenty of time to talk about the different structures in CBT. I do want to explain it to you, but over the course of several sessions. Let's just take pieces of it for now.
Okay.
So, what we believe is that your beliefs combine with the situation and create these thoughts. So you have this belief, so you're laying in bed before work, and you have this belief that you're maybe not competent. And then the situation that combines with that is it's time to go to work. So the stress of, it being time to actually get up and get ready and go to work. And then you have an automatic thought in that moment. And right now it's one tied to dread and fear. Let's try to identify an exact one for this example. So let's use that scenario. You believe that you might not be competent. You're laying in bed and the alarm clock goes off. So you're kind of pressured to make a decision about, do I get ready for work or not? What's the thought right then?
If I go to work, I'm going to make a mistake.
Going to make a mistake. So if I go, I'm going to make a mistake. And then we talked about your reactions, being late, worry, anxiety. So what we like to do when we identify an automatic thought like that is what's called self-talk. And at first this may seem a little odd, right? So you have this thought that comes through. It can be an image too, a thought, image, but it's cognitive in nature. And I can't make a mistake. Like, I'm going to make a mistake. I'm going to make a mistake. That's your thought. And this self-talk, this is like a rehearsed statement that you literally say to yourself. Which again, I get that seems a little odd the first time you might do it. So really you're talking to yourself. But over time, we believe if you can keep applying the self-talk strategy, that you will eventually change the outcome, the reaction, and change the underlying belief.
Okay.
At first, though, it's going to seem quite foreign to you. Right, tell me how you're processing this now in terms of...
So, what am I supposed to say to myself, I guess?
It's a good question. We'll work on that, and that's what we can do now.
Okay.
Let's take a look at some self-talk, some adaptive responses that we can build. So, I'm going to make a mistake. That's the automatic thought. That's directly leading, seems to be, to feelings of worry, dread, and physically not getting to work on time. Have there ever been times when you've had that thought and you went to work on time still?
Yeah.
All right. What was different about those times?
I guess I told myself I have to get to work on time because if I don't, it's going to be even worse. If I make a mistake and I'm late, then it just, it compounds, and I guess I would tell myself it's going to be okay, you just have to get through this day.
Alright, so when you do that, in essence you are applying self-talk.
Okay.
Alright, so that's really the same thing, except you probably didn't have a label for it. And when you apply that, it seems to work. Right? So the message you're kind of sending yourself now, you're telling yourself is, I'm going to make a mistake still, but if I'm late for work, it'll be worse. So there's a little bit of positive and negative in the...
Yeah.
Okay. That's okay. Right? Self-talk doesn't have to be all positive. Self-talk needs to be, I think, more than anything, realistic.
Okay.
And sometimes realistic includes a little negativity. I'd rather focus on the more positive elements as we build this if possible, though.
Okay.
So that's pretty good self-talk you have now. Let's work on refining it a little bit to maximize its benefit.